I want to open with a question. I'd love to know, drop it in the comments. How many of you who have gone through narcissistic abuse or know someone who's gone through narcissistic abuse have struggled with chronic pain? That pain that doesn't go away and that really wrecks your life. So let's see where people are at with that, because that's what we're going to take on today. This idea of people who are going through narcissistic abuse and for some reason quite often are also struggling with chronic pain. I'm Dr. Ramani. Welcome to this YouTube channel that takes on all kinds of issues related to narcissism, narcissistic relationships, narcissistic people. It's my hope that by understanding these patterns, you'll be in a position to better able to not only navigate these relationships, but heal from them, or ideally, avoid them in the first place. For those of you who are interested in healing, please go to the video notes. You can hit that link and learn more about a more deep dive healing program we're having, and certainly people living with chronic pain knows how much this can affect their lives. And if you're new to this channel, also please subscribe and join this community. So let's talk about chronic pain and narcissistic abuse. One issue I have talked about on this YouTube channel is the impact of narcissistic abuse on our health, our physical health. It's clear that it does a number on our mental health, but our physical health, just literally how our bodies feel. And the linkages are pretty clear. If for no other reason than that narcissistic abuse is a massive stressor, and often a lifelong stressor, and the immune impacts, the central nervous system impacts, and in turn the impacts on all bodily systems are quite compelling. I have worked with and talked with myriad survivors who have shared stories of illnesses they had very few sort of biological or genetic or behavioral risks for, or who had the onset or exacerbation of things like autoimmune conditions that are impacted by stress. And something else I am seeing more and more in survivors is chronic pain. Chronic pain is the pain that persists after the physiological causes of the pain have largely healed or are ruled out. So for example, when a person, first breaks a bone, or in the weeks after a surgery, we see acute pain. There's surgery or there's an injury, and the pain is a clear byproduct of that. Medications and therapies and icing and things like that are used to manage it. But over time, things may transition to a point where there's really no longer a clear identifiable physiological cause that makes sense, and then pain is treated and conceptualized as chronic pain. Chronic pain isn't fake, it's very, very real, and it's hard to treat because the cause isn't always as clear. There's no surgery that can be done. There's no way to even follow or track the biological progress except to ask the person their pain level. And as you can imagine, when a person experiences chronic pain, some of the risks include things like potentially getting dependent on narcotic medications and limitations other areas of life, not being able to work or things like that, or mental health issues. Lots of depression in people with chronic pain. So you're not going to be surprised when I tell you that people who experience long-term narcissistic abuse are often at risk for chronic pain. And there are a few reasons for this. First, many people who experience narcissistic abuse do not address their own physical health, sometimes for many years. They often do not get preventative health care, for example, even physicals and things like that, as often as they should. And they don't care for themselves, and the narcissistic people in their lives are not going to care for them. So when they're ill, or just they need to, they might even do things like delay medical care. So medical issues can get missed, and the ongoing stress of the narcissistic abuse can impact a person physiologically in a manner that presents as pain. In addition, if a person experiencing long-term narcissistic abuse is experiencing a medical issue, or perhaps recovering from something like a surgery or an illness, once again, it's not likely that the narcissistic people in their lives are going to pitch in to take care of them. So as a result, we may see longer lasting pain post-surgically or post-illness, and then a greater likelihood of chronic pain. Pain is a really funny beast. Psychological pain and physical pain are experienced somewhat similarly in the brain. Dr. Naomi Eisenberger's groundbreaking research shows that both social pain and physical pain sort of share these sort of neural origins in our brain, meaning that our brain experiences both. Social and physical pain is just pain. Broken heart, broken arm, the brain just knows it as pain. And again, similar areas of the brain subserve that pain, whether it's social or physical. Narcissistic abuse is a daily, sometimes decades-long broken heart. And what this means is that people who experience narcissistic abuse may be more vulnerable to experiencing long-term physical pain and have poorer outcomes when they experience any kind of an illness or injury or surgery. Now, this is really real. If you are experiencing narcissistic abuse, this isn't just about the psychological harm of these relationships, because they are, but we feel these in our bodies. I am sure many of you have had this experience, that this relationship literally makes you sick. The difficult part, and I have witnessed it firsthand with long-term survivors of narcissistic abuse, is that the medical establishment doesn't really get it. So if you try to frame sort of experience of chronic pain to healthcare professionals, and I've done this on behalf of patients, that you try to share that this person's in a long-term toxic relationship that may be exacerbating or even creating their pain experience, you're probably going to get blank stares. Maybe there's some truth to that, because the healthcare professionals aren't going to tell you to get a divorce or stop talking to your mother as a way of benefiting or treating your pain. But I do wonder if cutting toxic people out of your life may be more powerful than any narcotic out there for your pain, especially chronic pain. When we are around toxic people, we tend to tense up. We hold our breath. We move more cautiously. We walk on eggshells. And we also have floods of stress hormones when we are shouted at or gaslighted. And all of this worsens the pain response. Even for people who are long-term survivors of narcissistic abuse, they will report that simply observing hostile behavior in other people, in the news, in a movie, out in public, they will physiologically feel it, and often as pain. I actually do think that from a physical standpoint, chronic pain is a major hazard of narcissistic relationships. And when people are getting worked up by healthcare providers for pain, trying to determine the cause of the pain, little attention is paid to the contribution of these relationships, of toxic relationships, to the ongoing maintenance of the pain. But we cannot underestimate the impact of these relationships to the very real physiological experiences we have. And if you are experiencing chronic pain and are experiencing narcissistic abuse, just to understand that there's likely a connection between the two so you can be kinder to yourself. Many times, people with chronic pain are pathologized. They're told that it's all in their head, that they're being dramatic, that there might even just be something wrong with their head that's beyond the pain. And this is a really bad mix for a survivor of narcissistic abuse who already tends towards self-doubt and self-blame. So combined with the self-blame of the chronic pain, well, they can't find a cause for this pain, so this must be something I'm making up. It can be a really bad place physically and mentally for a person who's going through narcissistic abuse, who not only doubt themselves, now they actually literally doubt their pain. So the next time you think that your narcissistic relationship is a pain in the neck, you may not be that far from the truth. And this is a pain you cannot just medicate away. In these situations of chronic pain, a combination of working with good multidisciplinary pain teams, having therapy, and recognizing that the presence of this relationship is making any health issue you're having worse can be a real wake-up call. Thanks again.